My passion is to be able to interact with patients and educate them as well as colleagues. And so when the DNP idea came about, I said, that's where I want to be. That's what I want to do. When I was looking for a doctorate program, I wanted to be able to find a program that had the same qualities of all the 12 years that I've had that private learning experience. And it certainly is very evident here at WesternU. The students, the faculty, the assistant staff are all so warm, and they're very caring, and they really want you to excel.
I went to the information session here, and that sold it for me. You can tell from the faculty and the staff that they had a passion for what they taught, and they really were going to get me ready to be a nurse. When I started the application process here, there was an immediate attention to me as an individual. And amongst nursing schools, this is one of the few that actually interview their applicants. I thought that was crucial. As far as public and private, a good education is worth the money. That individuality, that being able to be accepted and being taught on an individual level, that they can flex their learning style and their teaching style on us without having to go through a lot of red tape to get it done, is extremely important. I like to look at everybody as a person, not as a case. And that idea that they train you to think about every person as a whole, like who are they, what does that mean for their health, it helps you become a better clinician, a better nurse, because now you're looking at everything and you're looking at the whole person. So that melds a lot with how I want to view myself as a professional.
After I graduated, I realized I really did want to go to nursing school. But going back and getting a full second bachelor's degree for me wasn't most cost effective, wasn't time effective. So I wanted to look into programs where I could further my education, but could also then get into the nursing field. So Western was a perfect place for me because, in essence, we get our bachelor's, but I can continue on to the master's portion. So it sort of fit my need of getting into nursing, but by not having me go back and getting a full 4-year bachelor's degree as well. So it's a quicker way of doing what I wanted to do and then being able to go on and further my education.
I really like the way the program works. I like the hybrid. I never wanted to be in an online program, and I really can't work my way into a regular school program because I need the flexibility of the schedule. So I really like that I get both, even though to a more limited extent, but I really like the idea that I can have a peer group that I can actually get to know and work together with and have personal relationships with, but at the same time have that flexibility of an online learning program.
Western University gives me that opportunity to not only become a registered nurse, but also to streamline into my master's degree and offering me to be able to advance in nurse practitioner.
After doing my research from all the ADN to MSN programs in California, I actually found that Western University definitely accommodates a full-time work schedule, full-time nursing schedule.
I decided to come to Western University of Health Sciences for the Postmaster's F&P program, mainly because of the track record that the graduates have of passing the National Certification Board with 100% pass rate. That was the most attractive thing to me because I knew that the faculty would help me achieve that myself. In addition, I'm from British Columbia, Canada, and the nurse practitioner role there was just legislated in 2005. And so I wanted to have the benefit of faculty who are experienced nurse practitioners with their wealth of experience and knowledge, so I could gain from their expertise and experience.
I chose WesternU mainly for their IPE program. I'm a big, strong believer in interprofessional communication and collaboration. I think that's the future of healthcare. I see that that's where it's going. The very best hospitals and clinics in our nation already utilize it, and so I wanted to be part of a program that would not only prepare me to do it, but I wanted to be in the position where I could potentially be a leader in that field. And so I really feel that Western has already started to give me the tools I need to do that.
What I saw as far as the humanistic, the compassion, the empathy, as well as the leadership that both Western University and the College of Graduate Nursing is looking for. I feel like it fit perfect with what I wanted to do. I hope to become a hospital administrator down the road at some point in my life. And I've done a handful of interviews with various hospital CEOs to see what the best approach for that would be, to see my goal or my dream succeed. This university is unique because you see the president of the university, the founder of this university, out walking around and talking to the students, figuring out what's the best thing that's here on campus, what can be changed, what can be improved. The other day I had the opportunity to sit down with an interview and talk to him about what he saw as his future vision for this university. It's going to be incredible. There's great things that are coming, and this university is very approachable as far as the entire staff and everybody involved. So you're going to have a great time here. I hope you choose Western University.